Next, our series, The End of AIDS, wraps up in South Africa, where this week many of the world's top scientists, researchers, and advocates are meeting in Durban. Among the topics, is the end of AIDS really a possibility? This is the final report in our series, which has been supported by the Pulitzer Center on Crisis Reporting.
In South Africa, we see very large disparities in HIV infections, with less than 1% of white South Africans having the disease compared to 20% of black South Africans. There are a number of theories as to why these disparities exist, from cultural values to sex education. Some argue that STI rates are due to promiscuity and hypersexuality without an emphasis placed on safety. Others place weight primarily on social poverty and a lack of access to preventative measures. The comparison we make between South Africa and the United States allows for a meaningful comparison considering their racial histories. Both the United States and South Africa have subjugated their black population via government and institutional means. Likewise, in both of these countries, we see huge STI disparities between their black and white populations. Tonight, we hope to make an investigation and give a theoretical framework and explanation as to why this is the case.
In South Africa, there's tremendous HIV disparities in racial and ethnic groups. The highest percentages fall on black individuals, which is 19.9%, colors being 3.2%, and 0.5% among whites. This is according to a network level explanation of the differences in HIV prevalence in South Africa's racial groups. According to another article, why do some African ethnic groups have very high HIV rates and others do not? Ages 14 to 25-year-olds were in a study. This study showed the behavioral risk of concurrent relationships, also known as currency, which is defined as sexual partnerships overlapping in time. One partnership starts before the other ends. According to the data, currency among black individuals is the highest compared to other races. Black men's participation in currency is 41%, coloreds being 21%, and white men being at 4%.
Racial and ethnic minorities have higher rates of STIs and HIV compared to the majority groups in the U.S. In 2018, the CDC reports that African American women had 5 times the cases of chlamydia compared to white women. African American men had 6.8 times the cases of chlamydia compared to white men. African Americans had 4.7 times the cases of syphilis compared to whites. African Americans also accounted for 42% of new cases of HIV. 31% were men and 11% were women. The CDC also reports that Hispanic Americans accounted for 27% of new cases of HIV. Hispanics had 1.9 times the cases of chlamydia and 1.6 times the cases of gonorrhea compared to whites. As with most severe cases, in order to solve any issue, we must start with the problems framework. Ms. Kendall, please enlighten the viewers on what the issue stems from and what we can do.
According to the nonprofit Health News, only 5% of South African public schools include comprehensive sex education. Opting a child out of these lessons is due to the belief that allowing children to learn about their bodies will lead to an early interest in sex. In this same culture, 10.9% of births in 2017 were to girls still in school, ages 10 to 19. The conversation around sex in many cultures perpetuates fear. Social determinants of unplanned pregnancies and sexually transmitted infections are tightly correlated with a lack of education and religious preconceptions. Religious preconceptions regarding sex are often rooted, not in science, but in far outdated, non-secular ideas on reproduction, which is dangerous as background accurate knowledge about sexually transmitted infections is imperative for young people's sexual health outcomes. But as previously mentioned, STI knowledge has been found to be inadequate among youth. The World Health Organization acknowledges that sex education should effectively facilitate critical thinking with the broader aim of respecting sexual diversity, gender equality, and a focus on the positive and pleasurable aspects of sexuality.
Thank you for having me, Ms. Kendall. Currently, the United States has several ways to combat STIs, from pre-exposure vaccinations and condoms to several ways to treat and manage STIs once they've been contracted, but it is always better to prevent STIs rather than treat them. That is why I recommend increasing public knowledge on the problem by increasing funding to schools and community programs to reduce the stigma associated with STIs so that no one is afraid to seek help and the public will be better prepared to protect themselves. One proven way that is already in use but I suggest expanding upon is the use of latex condoms. One study showed how in heterosexual HIV mixed status relationships in which condoms were used consistently, HIV-negative partners were 71 to 80% less likely to become infected with HIV, compared with people in similar relationships in which condoms were not used. Allocating money to provide free condoms to whoever need them will help reduce the spread of STIs.
Get on to me here today, Kyle. Currently, South Africa is focusing on the National Strategic Plan that runs through the year 2017 to 2022. Coming to a close, the tremendous impact the mission statement was to eliminate the spread of HIV, TB, and STIs. Now, the protocol focuses on breaking the cycle of transmission, and this is simply done by addressing appropriately and defining the factors that contribute to the increasing of the percentage of transmission in South Africa. Now, the process actually commences through the districts are categorized by vulnerability and the need of help. Now, this is done by putting everyone into 27 subgroups in the country and going through a protocol called Test and Treat. Now, although this may happen and will be finishing soon, it has increased the life expectancy of males and females with factors incorporated in reduction of STIs. The centralized 27 districts have already been looking and helping other people. However, an additional factor that may enhance the individuals who are affected are generally speaking to the adolescents in public schools, just like Kyle said. Currently, more vulnerable people are being targeted. However, it is not targeted to every subgroup in Africa, meaning that those who are more fortunate may also not be educated.